Hello, Dr. Robert LaLouche, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about being thin and pregnant. And we're basically going to go over some of my experience and a few things that are different that you might experience if you're very thin during pregnancy than someone who's of average weight or overweight. Now, I live in the Midwest, and one of the states where there's more problems with obesity than thinness. But there are definitely women who are on the thinner side. If you're really thin, then that can actually interfere with your ability to get pregnant. Okay, it can alter your hormones. There is something magical about 120 pounds. But assuming you're pregnant and you're very thin, then you may encounter some issues more often than women who are of normal weight. So pretty common for thin women to get dizzy and nauseous more often, and also to have episodes of passing out, especially in the first trimester. So some interventions can help prevent this, can help prevent you from having these issues. Generally speaking, thin women have a great pregnancy outcome and do well. There is a slightly higher chance of a smaller baby or for preterm labor, especially if you're at the extremes. There are other videos on diet and pregnancy. I encourage you to watch that. But during pregnancy, your baby is growing and you have a certain amount of glucose in your bloodstream, blood sugar, and your baby has a higher affinity than you do. What that means is if there's a battle between you and your baby to get that sugar, your baby wins, okay? And you get to feel nauseous or dizzy. Also, if you're not drinking enough fluids, then you're more likely to get, if you're very thin, to get a little dizzy and sometimes pass out. And again, when the baby needs fluids, then you get the symptoms and the baby benefits and gets the fluids first, okay? So your body diverts blood flow and spares the baby first and makes you have those symptoms. So a little bit more dizziness. There's a whole episode on dizziness and pregnancy. But if you're a very thin person, you have to get used to snacking and always have snacks with you and have drinks. And I imagine it's a generalization, but a lot of my patients are soda drinkers or sweet tea drinkers if they're very thin. And be careful about the amount of caffeine you drink. We know that 5 servings of caffeine a day is linked to miscarriage. We don't know a safe amount, but small amounts are okay. But be careful about having caffeinated drinks throughout the day. I encourage you to drink drinks with calories if you're that thin, like milk. Fruit's better than juice in general, but if you're real thin, some fruit juices are good source of calorie. If it's hot and you're sweating, occasionally some Gatorade will help with the electrolytes to help prevent those symptoms, the dizziness. But carry with your purse or carry with you a snack that has a little bit of protein, a little bit of fat, and a little bit of carbohydrate in it, like, for example, a Nutri-Grain bar or a granola bar or some fruit or even dried fruit. Fresh fruit is always great, but you need to be eating like 6 small meals a day and early on. The other thing is, when you are thin, not everyone does this, but a lot of thin women I know don't eat breakfast and they just have a caffeine drink, like coffee or a soda, without any calories. And while that may work when you're not pregnant, when you are pregnant, that helps contribute to dizziness and the weakness and exhaustion that you might experience. So add some calories. Healthy calories are better than, meaning fresh fruits and vegetables, things that Mother Nature makes, rather than highly processed foods that are prepackaged and made by humans. So these are some generalizations. I also, by the way, one more thing I want to mention is I have patients who end up in the ER because they pass out, or they have heart palpitations, and they end up getting heart scans and seeing cardiologists. And if you haven't had that problem before, or those issues before, certainly follow the instructions having a real serious heart problem is extremely rare, not zero. But if you do some of these interventions, you can avoid having those symptoms, which can really disrupt your life. So I hope you found this helpful. Please leave your comments. Thank you.